Hey, welcome back again, viewers and subscribers. This moment, I want to be doing this video on mango, Mangifera indica, speaking about the leaves, mango leaves, and it's always being purported that mango leaves can be used to treat diabetes. And yes, if you're asking if there is any scientific proof, any evidence base, research, yes, there are in fact evidence-based research and scientific studies. Right now, mango contains the bioactive compound mangiferin, which, if you've seen that other video that I did a few years back when I just started this channel, this compound can actually treat cancer, mangiferin. It also is responsible for having an effect on diabetes. Now, diabetes is chronic high blood sugar, right? This is because of the body's inability to produce enough insulin or to observe the insulin that when secreted by the beta cells of the pancreas, right? So it leads to hyperglycemia, high blood sugar, all that sugar in the blood, which leads to type 1 or type 2 diabetes. Now, mango mango leaves contain anthocyanidins, which have an effect on preventing development of early diabetes, and also it has an impact on glycogen synthesis, right? And also contains beta carotene, zeaxanthin, and many other nutrients there. Also the tannins, also called mangiferin, right? And also I found other information which speaks on free radicals, right? I found a study in Australia back in 2009 where they identified free radical as a precursor to developing, a catalyst to developing diabetes, which is quite interesting because anthocyanins is also present in mango leaves and other plants. These water-soluble pigments that give these plants their color, right? Which can either be acidic, depends on the environment, depends on the temperature, the time of the day, the pH, right? Can be alkaline, depends on the color really depends on whether it's acidic or whether it's alkaline, red, blue, purple, right? So these are, as you have known from watching my videos, right? These anthocyanins are responsible for cardiovascular health, right? And protecting the body from chronic diseases, right? These free radicals cause oxidative stress, and from my understanding, from what I've read, there has to be a balance, right, between these free radicals and these antioxidants, right? Too many free radicals, more than antioxidants, right, can lead to development of diabetes. So that's interesting. Free radicals. So I'll urge you, I advise you to make sure you get in as much antioxidants as much as possible. This mango tree here, this is called a copper tree, right? From since we're young, this mango tree has been here, right? There are other varieties, right? Especially what we have in St. Vincent, the horsey, parley, the blackie, the grafted, and Paulover, and Buchan, many other varieties, right? So as always, consult your healthcare provider, right? When using these herbs, these plants, right? Because mango leaves combined with medications like metformin and glyburide can actually cause your blood sugar to lower too much. Zoom in here. It's blossoming, doesn't have any fruits on there. These are the leaves there, right? Mango leaves, from what I've read, scientific studies done on animal models, animals, in vivo, right? Live studies in vitro in the lab. Well, they're saying also there needs to be done larger human large scale human trials, right? And the evidence is not conclusive that can be used as a standalone treatment, right? And also in regards to calculating the recommended dosage. So still caution is to be advised, but mango himself is comparable to diabetic medications like metformin and glyburide, right? So yeah, so that's it. Mango leaves, Mangifera indica. Thanks again for watching.